So you should be on page 76 in your step-by-step again for the first listed diagnosis. And then in your ICD9 manuals, you should be on page 51. Okay? Step-by-step, page 76, and in your ICD9 book, page 51. And on page 51, let's take a look at where it says selection of the first listed diagnosis. So now we're referring to outpatient. So when we say first listed diagnosis, do you remember what a first listed diagnosis really means?
The reason why you want to use it in doctor's office.
Exactly. Very good, all three of you. The reason why the patient came in. So now let's go back and look at the example on page 76. We said that it was an established patient. What's the difference, do we remember, between new and established? Yes, Suzanne.
An established patient is one that's been seen in that practice by a doctor in the same specialty within the last 3 years.
Right. It would be a patient who's been seen by that specialty or in that practice in the last 3 years. So we have an established patient who is 50 years old. It says the patient was seen in the clinic for acute bronchitis. Patient also received a prescription for refill of medication for hypertension. So now the patient came in, had acute bronchitis, but the patient also has hypertension. They even received a prescription for it. But in this case, what would be our first listed diagnosis?
Acute bronchitis.
Acute bronchitis, because that's what they came in for, right? Now let's take a look at the second example. And what does that one say, Laura?
Initial office visit for a 36-year-old female complaining of irregular menses. Review of symptoms identified, explained weight loss. Do you want me to read the first listed diagnosis?
Okay, no, you don't.
Okay.
So this was an initial office visit. So initial tells you that this is a new patient. Good. And it is for a 36-year-old female. Now her complaint was that she was having an irregular menstrual cycle. Okay? But then she also had unexplained weight loss. What was the first listed diagnosis for this patient?
Irregular menses.
Irregular menses. And then we would consider the weight loss later. All right, and number 3, we have an established patient. And Judith, could you read number 3 for us?
Established patient is a 75-year-old male complaining of substernal chest pain, which is relieved with rest. Patient has hypertension and blood pressure. Is above baseline on this visit.
Okay, good. So now we have an established patient with substernal chest pain. The question I have for you, what is the first listed diagnosis?
Substernal chest pain.
So again, it goes back to what the guidelines say. The first listed diagnosis would be the reason that that patient was presented today. If you look on page 51 in the ICD9 manual, under the letter A, it says selection of the first listed condition. In the outpatient setting, the term first listed diagnosis is used in lieu of what? Principal diagnosis. So in determining the first listed diagnosis, the coding conventions of ICD9, as well as the general and disease-specific guidelines, take precedence over the outpatient guidelines. And you remember that we talked about this. A patient can come in today with all these symptoms. Remember we wrote them on the board? And what is a symptom of gastroenteritis? Does anyone remember a symptom of gastroenteritis? Nausea. So vomiting. What else is a symptom?
Difficulty swallowing.
Okay, maybe some burning or like heartburn. Okay. Anything else that you can think of?
Cramps.
What about stomach pain?
Yes.
Right.
Will we have stomach pain?
Cramps.
Cramps. Okay, so we'll leave that with the stomach pain. So all of these are symptoms. So the first day when the patient comes in, they may say to the physician, I feel nauseated. I feel like I'm vomiting all the time. But these are not the definitive diagnosis, right? But once that physician says all of this is gastroenteritis, right? Once he says that all of this is gastroenteritis, let's say he did a lab test, H. pylori or something like that, and he comes back and he says they have gastroenteritis. That is a definitive diagnosis. And once we have our definitive diagnosis, do we need to code the symptoms anymore?
No.
No, because we have a definitive diagnosis. So you can see this process takes time. Your first